You know what they say, if it tastes good, it must be bad for your health. Sooner or later, the meat-packing, cheese-leaking burger you are having will end up as fat in your gut and plaque in your arteries. Well, this may be true for most food and condiments in the world, but not for the item we are going to discuss today. It tastes better itself and also adds taste when we use it with other foods. To make things much better and easier, it is cheap, and there is a good chance that you already have it on your kitchen shelves. So, let's talk about the magic of mustard. Before we dive in, don't forget to hit the subscribe button and the notification bell. Also, be sure to stick around to watch the video till the end. How mustard lowers cholesterol. A very recent study from the Cardiff Metropolitan University has found that only 1 teaspoon of whole grain mustard a day reduced the levels of bad cholesterol in our blood by almost 10%. The study was conducted on 55 participants who were between 40 to 70 years of age and are either overweight or obese. The participants took 10 grams or 1 heaped teaspoon of whole grain mustard every day for 12 weeks straight. The result was astonishing. In 86% of the cases, the mustard helps to considerably lower blood cholesterol level. They achieved this without any strict diet, and you can too. How mustard lowers blood sugar. But mustard's miraculous benefits go far beyond the realm of cholesterol reduction. Those struggling with diabetes and blood sugar issues can highly profit from making mustard a part of your daily food intake. It has been found in studies that when type 2 diabetes patients take mustard on a regular basis alongside their medication, it gives a surprising result. Also, diabetes patients are also at risk of eye problems, such as cataracts, glaucoma, and loss of vision. A 2010 study found that extract from mustard leaves can help prevent the development of cataracts among diabetes patients. Full of antioxidants. Mustards are also packed with antioxidants, and we all know what antioxidants can do. They stop inflammation and slow the aging process of your body. A 2016 study found that mustard is rich in sinigrin, which is a special antioxidant that has anti-cancer, antibacterial, antifungal properties as well. How to use mustard. So, keeping all these amazing health benefits of mustard, let's see how we can make it part of our regular food intake. A very popular way to consume mustard is as oil. Mustard oil is getting increasingly popular by the day. You can use mustard in your sandwich as a substitute for your regular ketchup and mayonnaise. Also, a combination of mustard and natural honey is great as a salad dressing. Just throw in some extra virgin olive oil, some black pepper, apple cider vinegar, and a pinch of sea salt to add to the taste. Mustard can also be used when cooking fish. Next time, before you bake that delicious salmon fillet, prepare a mixture of 1 part natural honey, 1 part whole grain mustard, extra virgin olive oil, a small quantity of lemon juice, and some salt. Pour the mixture over the fish fillets before baking them. Necessary precautions you must take. When you take mustard as oil, the monthly intake should not cross 600 to 700 milliliters, which means around 1 teaspoon each meal. If you consume an excessive amount of mustard, it can cause inflammation in your gut, abdominal pain, and diarrhea. While mustard is definitely helpful in lowering blood sugar levels, it is no alternative to medication. Diabetes patients must continue their medication and consult with a healthcare professional before making mustard a part of everyday life. Sometimes, consuming a heaped teaspoon of whole grain mustard can be so overwhelming for some that it can make their eyes water. In that case, mix it with olive oil, honey, and give your body some time to adjust to the unique taste and texture of mustard. And with that note, we wrap up today's video. If you have other health conditions, please consult with your nearest doctor before taking mustard. Let us know your thoughts in the comments below. For more queries, I have also added some studies at the end of this video description. And don't forget to like, comment, and share. Stay healthy, stay fine.